want to show you briefly some of the data available from the Levant clinical trial program. Well, as you know, clearly the Lutonix balloon is probably was the first approved in the United States, and the one with the longest track record, probably also the most clinical indications for SFA, instant recinos, long lesions, and AV shunts, and more than 200,000 patients treated worldwide clinically in trials and in clinical use. Well, paclitaxel, a lot has been said about this, so I don't want to go into this. It's clearly Lutonix balloon is also used in paclitaxel. It was tested extensively preclinically to finally come up with the optimized Lutonix coating, which, as you know, uses a relatively low dose paclitaxel concentration of 2 microgram per square millimeters, and it was actually tested in GLP porcine studies, of course, for downstream effects, which have been discussed quite intensively, but also for systemic toxicity, and basically the data support the use of balloons for up to 1 meter treated lesion. The serum paclitaxel level is less than 3 nanogram per milliliter at 1 hour, and there's a very rapid elimination with a mean elimination half time of 46.8 hours. So this slide summarizes basically the data points from all the Lutonix trials. Basically here in this table, all the randomized trials, the Levant 1, the whole Levant cohorts, which have a follow-up out to 5 years. The randomized trial in Japan, and the randomized instant restenosis trial. And basically, in none of the trials, any significant difference has been seen in all-cause death. And also the observed rates in the registries, it's shown here, long lesion registry and the global registry, are within the expected range. This is the all-cause death rate from the Levant 2 studies, basically showing non-significant difference at 5 years. However, clearly a slight trend here with a somewhat higher mortality in the DCB arm. However, we clearly have to look also at the numbers at risk, and very clearly due to the randomization scheme and the fact that, of course, the more patients were entered, more DCB patients were entered into the registries, the numbers which basically represent the data foundation for the DCB curve are much more profound. And of course, in the PTA arm, we are dealing here with as in all these studies, I think, with a relatively small control group, which of course can be affected by individual numbers very strongly. Well, if we look specifically at the hypothesis that an increased paclitaxel dose could lead to a higher mortality, as stipulated by Katsanos, we looked at the different dose groups in the Lutonix in the Levant 2 trials, basically on the low dose group and basically in 4 quartiles, as you can see here, up to a high dose group. And basically we can see that the all-cause death rate in all these groups is quite comparable, in fact statistically not different. So there's no higher mortality observed here at all in the higher dose groups compared to the lower dose groups, and that was done with a binary analysis, and here on the right with a Kaplan-Meier analysis, which gives kind of the same findings. Another analysis which was carried out was to look at the all-cause mortality by time. That's shown here in the table on the right side. Basically, you can see here the comparative death rates at 1 year, 2 years, 3 years, 4 out to 5 years. And you can see that actually at no time point there was a statistically significant difference. And in general, of course, it's difficult to say what we expect, but if you look at data points from historical literature, then I think all the data points shown here in this study and also in the other studies which have been reported today are actually quite low compared to some of the numbers reported for PAD, typical PAD cohorts. Well, what was causing the deaths? Also, this was, of course, analyzed, and you can see here the display in the table. Cardiovascular death was relevant in about 3 to 5% of the cases, and other than that, really nothing is catching really attention here. I mean, they're all well distributed, the causes over the two groups. So in summary, we can say that the Lutonix balloon, of course, was designed for safety. It's a coating which uses a low paclitaxel dose density. It's rapidly cleared from the blood, and basically, this studies showed no difference of all-cause deaths between DCB and PTA in general, and also not by dose, and not at any of the time points between 1 and 5 years. Thank you very much.